This is the Gutsy Health Podcast with Juanique and Tristin and Juanique. Hey everybody, this is the Gutsy Health Podcast. We have a really exciting lineup for you guys today.
Welcome everybody. This is going to be awesome.
Yeah, it's because one of my favorite doctors is with us, Dr. John Sanders. And you guys, you need to hear his story. He is absolutely phenomenal. And before I go into the story of how we met him, I just want to explain that the reason why we love him so much is because he saw a broken medical system and he is single-handedly trying to fix that for his patients because he recognizes that that patients deserve more from their doctors and their medical team, and they're not getting that. So welcome,
there
John.
Are
Thank you.
Monuments to him in the future.
Yeah.
But really, guys, $3.5 trillion. That is why this podcast episode is really important, because $3.5 trillion is how much we spent in America on healthcare in 2017, which was 2 years ago. That number increases by about 4% per year right now, which means that by the end of 2019, we will have spent close to $3.8 trillion.
Isn't that like $1 for every $5 our country makes or something?
That's right.
So it's like 20% of our money.
The money we're producing in this country is being thrown right back out the window to
make us sicker, basically. So anyways, welcome, John. Or welcome, Dr. Sanders. Thank you for... Sorry. I'm so sorry. Welcome, Dr. John Sanders.
I'm
getting a little too comfortable.
Excited to be here. Thank you for having me. I appreciate that.
Thank you for your time. So I'll just quickly tell you guys how I met Dr. John Sanders. Is my friend Nicole. She was at my house and she was telling me about a doctor's visit that she went to, and she got a text. And she said, "Oh, this is my doctor, and he's giving me an herbal protocol about what we're talking about what I spoke to him about a health concern." And I said, "Your doctor is texting you?"
Whoa, hold up. Was this about herbal?
What?
Herbal?
Like
he's doing an herbal protocol?
Yeah, it was like an herbal protocol, and
Over
he was
text?
texting her. And I'm like, what doctor cares that much? And so I said, I need his number. And so I think I called him immediately and I said, Dr. Sanders, I would really like to sit down and chat with you about your philosophies. And so he said, absolutely, tomorrow. And I'm like, who sees people that fast? And so we went into his office and he didn't take 10 minutes or 20 minutes. We sat down with him and our two screaming children for an hour. And he asked us about our lives. We asked him about his lives. He asked us our story. We asked him his story. And it's like we created a friend. And that felt so, and I don't want to say uncomfortable, but I'm so used to being in and out with a doctor and they're just pushing me out the door. And so to have someone who was warm and welcoming and actually wanted to know our story, that was like a breath of fresh air.
It was a little confusing. It was, but in a really good way.
Yeah, exactly.
Like, wait a second. Are we in the right place? Is this really a doctor or is this just some actor who's pretending here?
Exactly. So Dr. Sanders, will you tell us?
Well, first, can I say a little bit about him?
Yes.
I pulled your bio off of the internet, and so I hope it's accurate. But here's the test. It says here that you went to Nova Southeastern College of Osteopathic Medicine in Fort Lauderdale, Florida.
Yes.
Right? And then you did your residency in Jacksonville, Florida at St. Vincent's Medical Center.
Yeah, it was in family medicine with an emphasis in rural medicine.
That's
right.
Cool.
And you ended up actually using that for several years.
In
you
Moab,
practiced
right?
out of Moab, southern Utah. You probably had a pretty big range that you covered.
Yeah, in Moab, I covered the ER, the hospital, obstetrics, surgical obstetrics where needed, dermatology, pediatrics.
Wow.
Dermatology, kind of everything. It was really fun.
So Dr. Sanders is a board-certified family physician, but he is a jack of all trades by necessity because that was kind of what you had to do down there, it sounds like.
Yeah, kind of the Swiss Army knife of medicine. Yeah.
Love it. That's really cool.
And then how long ago was it now? It's been a year and a half since you moved up here to Utah County?
Yeah, almost 2 now. My wife wanted to pursue further education with a law degree and an MBA. And so we moved up here, and I'm happy to support her in that effort.
And in doing that, he started what is called Voyage Direct Primary Care. And we're going to be talking a little bit about that today, along with some of Dr. Sanders' experience in medicine and healthcare and kind of navigating this whole system. So maybe we can jump into
the questions. Cool.
Yeah, let's do this.
Dr. John, did you always plan on becoming a doctor? Like, what was your story? What drove you into this world?
Yeah. So I actually, I grew up in a small town in central Nevada with no physician access. There was a chiropractor who would come out occasionally. We had a nurse practitioner that the mine hired for like sports physicals and stuff. And my mom was kind of a hobby herbalist and you know, homeopath and did all these. You know,
so you grew up with that.
Yeah.
That's really cool.
Yeah.
Sorry.
And so I wasn't sure if I wanted to go to I knew I wanted to pursue further education. I wasn't sure what exactly. And my junior year, I had the University of Nevada School of Medicine had a rural kids into medicine program where they would pull these kids from these rural communities and give them like a week at their medical school in Reno. Yeah. And I hung out there with the people and you know, saw the cadaver lab and saw science and these new levels and things and thought this is really cool. And I definitely want to pursue healthcare in some way. And I thought maybe chiropractics, maybe physical therapy, maybe naturopathic medical school. Mm-hmm. And my friend in college told me about osteopathic medical school. And I was like, oh, this is so cool. It's like a hybrid between a chiropractor and an MD, and you could kind of scope of practice isn't limited. Yeah. And
it's everything.
Yeah, it's a good fit. Yeah, it was a great fit. Yeah.
Cool. Very cool. Tell us about your training and your practice history. Tristin kind of briefly went over that, but what are some details that you think are important to your story?
Yeah. So just being able to, in osteopathy, I loved that, just coming from kind of my mentor, the chiropractor that would come out to my small town. Mm-hmm. It was great to hold true to some of those, you know, the touch part of medicine and being able to help people with your hands a little bit. That was really fun. And then, you know, doing a very robust residency in Jacksonville, doing lots of babies and lots of pediatric care and lots of hospital care and being able to really just kind of take care of a community in a rural setting was really, really fun.
Cool.
So I just want to go into a little bit more about a DO program, Doctor of Osteopathy. You mentioned it's kind of a hybrid between a medical doctor and a chiropractor. What would you say are the main differences there between you and someone who got an MD?
Yeah, so scope of practice is the same. You'll see DOs and MDs practicing side by side in the ORs and the ERs, in the hospitals. And so as far as scope of practice, there's not a whole lot of difference. Mm-hmm. In our training, I think we spend a little more time with the hands-on part, those kinds of things, and just tend to be, as a whole, a little more holistic minded, maybe. Mm-hmm. I think the allopaths are coming along with that, and I see more and more of my allopathic colleagues embracing more holistic mindsets and being able to put their arms around more of the natural things. But osteopaths are that's pretty straightforward for them.
That's awesome. Mm-hmm. Can you tell us your story that led you to creating Voyage and structuring it the way you have?
Yeah, Voyage Direct Primary Care. This is my baby. I started this about a year ago. I moved here from Moab. My wife is in school. We have 4 kids, and I took a job with one of the health system folks here, and it was a large organization, lots and lots of doctors, probably 200 or so.
Can you tell us which organization it is?
I probably shouldn't do that.
Okay. Then don't. Okay.
Either way, that must have been a bit of a culture shock going from being like the doctor for miles and miles to just a doctor in a giant
massive machine.
Yeah. The massive machine thing was the biggest turnoff for me. Mm-hmm. I about 2 months and I gave him the resignation card.
Wow. It only took 2 months.
Yeah.
That's amazing.
I knew that wasn't the right fit for me. Yeah. And I'm not a short-term guy, right? I don't take care of people short-term either. My goal is, as family medicine, we want continuity of care for 20 years, right? Yeah. And so if I am under their onus, I knew that was too crazy for me for the 20-year haul. Yeah. And so I just knew that I needed to make a quick change and do something different. Yeah. I'll tell you a story about the reason why I did Voyage Direct Primary Care. So under this model, it's broken in a lot of ways, right? The corporatization of medicine, the turn and burn model, this whole thing, and
turn and burn.
It creates this really quick access to really quick visits, and not enough time. I mean, these physicians are smart people, right? They go to all this robust training and all this, but they just are limited by the system to put their brains to work on folks. And so I knew I needed to change up that whole, like, it was a systemic situation instead of just like and the one thing for me was this sweet family. They came in and this mom brings in her son, and her son is swollen on all of his joints in his body. His wrists are swollen, his elbows are swollen, his knees are swollen, his ankles are swollen. He's just swollen on all his joints. And she's just kind of downcast, and she won't look at me. And I said, well, Mom, tell me a story. 'Cause that's how I usually start my visits. And she says, I feel really bad. And I said, well, try me. Let's just talk about it. And she says, I think my son had strep. And I think this is strep in his joints, and this can actually happen. And I said, well, what makes you think that? I mean, how are you so certain that this is strep? And she says, well, my daughter got sick about 10 days after he was sick, and it was similar, but she was quite sick, and we took her in. And the reason we didn't go in with him is because copays, deductibles, and we weren't sure. And just go in for a 5-minute visit, and the doc tell me that it's just a cold, and so I wasn't sure, and we didn't go. And then sure enough, 10 days later, her daughter was diagnosed with strep. And so it was the same thing, just went untreated. Yeah. Untreated strep can be catastrophic. And this is one of the potential sequela, what's the word for that? Outcomes from not treating strep. It would be post-streptococcal arthritis. And so this kid had major problems.
Oh my gosh.
I ended up spending like 3 hours on the phone with infectious disease, talking to them. What do they want me to do with this situation? Because it's not something you should see in America, right?
Yeah.
I've served mission trips to Haiti, to Mexico. I see stuff like this. It's interesting for me. Yeah. But in America, like a working family has insurance.
Yeah.
Why did I see this?
This should have been prevented.
Yeah.
Yeah.
And so that's what made me think, gosh, it's a systemic problem that's pushing families away from care instead of having easy access points to reach out to me, text, video chat, phone call, say, hey, doc, my son's sick. These are his symptoms. What do you think? Right? Yeah. Let me help you navigate that whole decision-making process. Yes. That's what I'm a pro at. That's what I do. Yes. And so there's just, anyway, that was for me the straw that broke the camel's back, and saying, insurance cards maybe don't deliver the type of care that I want to deliver. And so can I step outside of that model, still be cost effective, still be transparent, and deliver something different as far as a product of care?
Exactly.
Yeah, that is so important. And I can tell you from my own experience, I waited for several months before I actually started trying to figure out what was going on with my own issues, which ended up turning into, a stage 4 cancer by the time we found it. And a big part of my delay was insurance. I did not want to deal with the costs that would come with that, the insurance nightmare, the whole thing. So it was, One of the biggest problems that I see is a lack of transparency on what is going to get covered and how much things are going to cost. Yeah. And so that insurance card, you go to the doc, you use your insurance card, but nobody knows.
No one.
Neither I, nor my office manager, nor my patients, nobody knows how this is going to shake out financially.
Right.
And so there's just such a hidden lack of transparency game going on.
There's no menu.
There's no menu.
Zero menu. Like, can you just show me a menu? Like, so I know my expectation. Is this a $50 visit? Is it a $300 visit?
Yes.
You're completely right. And it's very scary.
I've got memories of us in our early marriage going to the urgent care and then waiting with anxiety for the mail to come to find out how bad is this going to be? Is it going to be $30? Is it going to be $300? Is it going to be $3,000?
Yeah.
And really, honestly, never knowing, because no one had any clue until, who knows, some person in a room somewhere makes that decision down the line. It's crazy.
So at Voyage Direct Primary Care, I have very transparent pricing. I have menus on labs, on imaging, on pathology. I know how much these services cost. And in fact, I advocate for my patients, and I go out and negotiate all those pieces of the healthcare pie. And I have them dialed in so that folks aren't left in the dark, and I'm not left in the dark either. Yeah. So it's sweet, and it's actually super cost effective. Actually, the pricing that I have been able to negotiate has been really awesome.
I talk a lot on Instagram about self-advocacy and advocating for yourself, your family. And you keep using that word so much. As a doctor, And I never hear doctors talk like that ever. But we need doctors to advocate for us, especially in hairy medical situations, like the strep, for instance. Yes, like, why is this not happening, right? And before we go into the why, can we, all three of us, just talk a little bit more? We keep talking about the system, right? There's a lot of people that don't, like, can we break down what this system exactly is? It's the insurance companies. It's like, for here in Utah, it's IHC, right? Like, what is this system? Can you explain it to us? Like, from a doctor's perspective, because in our layman's terms, as the patient, we don't know exactly what goes into these massive corporations and all of these things. So can you explain that to us?
Yeah. Healthcare has been hijacked a little bit by the businessman and by the insurance companies. And so it's created this corporatization structure, which it's administratively heavy and it's regulatorily heavy, if that's a word. And so there's the system is, me or my corporation or my boss provides a healthcare product to me and my family, right? Mm-hmm. And that may be in the form of an insurance, Select Health, Aetna, Blue Cross Blue Shield, Cigna, lots of them out there. And that costs a lot of money. And folks don't often realize how much that costs. So like if you're self-employed, you get it because you're paying for it. Mm-hmm. If you're not self-employed, then maybe you don't understand because it's only like $200 a paycheck. It seems like it works, right? But your employer is probably paying twice that. Mm-hmm. So for the average family, it's probably anywhere from $1,200 to $1,600 a month. Wow. that your employer and you split and pay that amount towards this insurance company. Yeah. That is not a no deductible plan. That's actually a high deductible, not a very great product plan.
Right.
and so the patients are left with this, and oh, by the way, they hand you this giant booklet that you're in charge of understanding and navigating. Here's your insurance, here's your booklet, figure it out, go to your people as needed.
You'd have better luck trying to figure out German, probably.
Yeah. Oh, dude. Yeah. Those are very, very complicated algorithms. Right. And they do that on purpose, right? They make it very, very complicated, very, 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 very complicated.
And as a doctor, for you to say they do that on purpose, like, I feel like that holds a lot of weight. Yeah. Because like it's very deceiving. And like you said in the beginning, it's a business, right? Like they're out to make money. Yeah,
no bones about it. Insurance companies are for profit. Mm-hmm. There's no question.
Exactly.
I think all too often people, especially coming from the world we come from in alternative health, we like to see doctors as the villains for some reason and claim that the doctors are trying to keep the truth suppressed or they're trying to keep us down. And the way I see it, the way I've seen it from my patient side of things is that doctors are every bit as much a victim in this scenario as the patients are because they're limited in so many different ways, both
because
in terms of the costs. Oh yeah, the insurance companies, I don't think anyone would argue that they're the villains here, but they also limit what doctors are able to do, right? And then you have your hands tied in several other ways because of insurance with your malpractice. And then you've got the American Medical Association, all these people telling you this is what you're allowed to do without getting in trouble. So you need to stay in your lane and do it very cautiously, right? But the insurance companies, above all else, they're the ones that are kind of putting these restraints on everybody and preventing us from getting the care that us patients really deserve to have.
Totally. What is that relationship like as a doctor with the insurance companies and all the insurance codes and stuff? Like, is it really as hairy as we patients see it?
It's extremely tedious and it's extremely regulatory. So they don't necessarily say that they come in to me and tell me how to practice medicine. They just don't cover that.
Wow.
Oh, we're not going to cover that diagnosis. We're not going to cover that service if you render it in that way.
Wow.
And so by so doing, they handcuff us to certain practices that they want us to do instead of that we want to do with our patients.
So even if you wanted to do something that was helpful to your patient, the insurance company is like, no, sorry, you're not going to get money because you went out of the scope of practice that we only approve.
It's not even scope of practice. It's just, they don't. Let me give you an example. So sometimes they'll change one of those ICD-10 codes, which just made it, let's further convolute or complicate medicine, right? Mm-hmm. Let's change the way you name things
Wow.
Which has nothing to do with the way I deliver care to people. But because you don't name it correctly, we're not going to cover that. And so
you have to learn a new language.
You have to learn a new
just
language.
to get paid.
That just recently changed, right? They just implemented ICD-10 a few years back. And so they keep changing it, and they move the cheese consistently on my part to keep me confused, right? And to keep money in their pockets. And I have to hire experts to just interface with them. So it's like having a merchant processing machine, like a credit card machine that takes 40 to 60 cents on the dollar. It's so inefficient because I have to hire this whole entourage of people to just deal with them.
To just interpret it for you.
Well, to build, to code, to scrub, and to collect, and then to rework, and then to rework again, and then to, that whole system is so inefficient. If you're a neurosurgeon and your one-time transaction with that merchant processor is, a $40,000 surgery, then it might be worth it, right?
Yeah.
But in family medicine, we deliver all kinds of care. That's small care. It's day-to-day stuff. It's a this, it's a that. And when you're taking, 60% of each of those small transactions, it becomes very, very inefficient for both parties, actually,
And for me, just listening to this, I'm like getting so angry. As a doctor, like, does that make you angry?
Well, I'm actually really happy right now because
you don't have to deal with that.
What I did was I dissolved all my contracts with all of the payers.
Yeah.
I now have no contracts, so I'm not beholden to any IHC,
no insurance companies,
any Blue Cross Blue Shield
0.
to do certain things a certain way. And so now I'm super free to just document how I want on my patients, take really good care of them, and order whatever I feel is appropriate for their care.
Yeah.
And we can talk, and my patients and I communicate all the time, and they're like, hey, think about this and think about that. And under the insurance realm, I'd have to say, well, I don't have the right code for that, and so I can't code it properly, so you'll probably pay cash for that, and I don't know what the cost of that lab is, so good luck. It's just one of those things.
Yes.
Whereas now we can just have a conversation, and I could say, that sounds reasonable. We should actually take a look at those labs, and oh, by the way, here's the cost. It's like $25 for like a whole panel of blood work. That's just a small example of the price point, but it's legitimate and it's fantastic.
So I know in our office, when we have clients come to us and they want to consult with us about their health and their hormones and whatnot, we normally we have like this really big list of labs because we want to see the whole picture, right? And so we'll say, take this to your doctor and have him order the blood work. But what we have since discovered is 9 out of 10 of those people will come back and be like, my doctor refused. And why are they refusing? Is it because the insurance companies are just going to deny that completely? Like, where's the disconnect with that?
So it's probably a couple fold, what I can see, and this is a little bit off topic from what we're talking about.
Okay.
But it's one of them is they don't have a vehicle to just order those without a diagnosis, right?
Okay.
You have
without
to have
reason, right?
You have to have a diagnosis. You have to have ICD-10 code.
Okay.
And so if you can't link the proper code to the proper lab, then they'll reject them.
Yeah.
And so some of those labs, frankly, it's just really, really tough. Like a vitamin D, for some reason, like unless they already are diagnosed with vitamin D deficiency under the insurance model, it's hard to order a vitamin D. Like they just won't cover it, and that's a pretty expensive test to run without Voyage Direct Primary Care.
Right.
And Voyage Direct Primary Care is pretty affordable, and so whereas I have a vehicle to say, oh, here are the price points to that. Is that okay with you? It's okay with me. High five. We're done.
Yeah.
The other thing that I think it might be is that doctors are used to like patients coming to them with a problem and then them like discerning like, should we order this? Should we order that? And what's appropriate and what's not? And so I think that might be just a little bit of what's going on as well. The docs are just like, wait, someone else that's not a healthcare professional told you that they want these labs and like, what do you mean? Like, let me help you. They do have some grounds to understanding, right? So like, the United States Preventive Services Task Force pretty much helps us as docs practice best practices. And what that means is fiscal responsibilities weighed into that, but also like, are we casting a broad enough net to capture things? And should we change the way we're practicing because maybe we're overdoing something like PAPS, right? The guidelines for PAPS changed, right? It's no longer every year from the time you're sexually active. The guideline's much different now.
Okay.
And so we're doing them less and less frequently because it marches out about the same as far as detecting cervical cancer and figuring that whole thing out. Okay. And so ordering all labs on everybody all the time is probably not appropriate, you know,
Okay.
and so that's a piece of the puzzle as well, and like ascertaining what's going on, and like I think a cooperative discussion, and you and I can talk about this afterwards, but like you know, a cooperative arrangement where you're like, hey, you know, here we are, and this is what we're doing, here's what we're thinking, and that kind of thing would be helpful.
But a lot of these people, and I just kind of want to get your input on it too. A lot of these people have been on these medical merry-go-rounds where like they have these illnesses that doctors don't know how to recognize. There's no diagnosis for it. And it's these people that are going to their doctors and like, please, can we just check under the entire hood? And doctors are completely denying them that because they don't understand what's going on.
That actually delineates another systemic problem. So the average healthcare professional can spend, I guess if you crunch the numbers, it'd probably be anywhere from 2 to like 12 minutes with a patient. And these are the docs, right? And so, and they, you know, it teaches in medical school, you know, 90% of your problems can be diagnosed by history alone, but we're not taking the time to take good histories because we don't have time to do that because half of our time is putting information in the computer that the insurance companies want.
Yes.
And so here we are, right? Shackled by the system. And instead of putting our brains and minds and thought processes to these folks, it's a struggle, right? So you can discuss one problem, and if that one or two, okay, 2 is max, that's it.
Yeah,
and that's
we don't have time
that's
for
under
3.
the insurance realm, right? That's not me, that's insurance. And so because that's a systemic problem, and insurance will pay you the same if you discuss 2 things or 5 things.
Wow.
So that's the thing. That's the
I
thing
did
too.
not know that. Oh my gosh.
Yeah. So that's a problem too, right? And so not only are we in a very inefficient system, only restricted to 2 things by this payer who will only pay for 2 things at once.
Right.
And so it creates a poor care, basically. It creates an inability for you to spend the time, ask the questions, dig a little deeper. One of my favorite things in Voyage Direct Primary Care is unearthing some things that have been swept under the rug or just simply not probed deep enough. I spent 5 minutes instead of, I spend like 60 minutes with my new patients and we go into detail, we get more questions, we get more information out of them. And I found some significant pathology in the community of well families, right? These families, we just don't go to the doctor, like quote unquote. And they're pretty healthy. We got a healthy family. Well, let me just ask you a few questions about this sweet, healthy family of yours. And we ask some questions and it's not like I'm trying to find bad things, but dude, bad things do exist. And it's important to ask a few extra questions, spend a little more time and use your degree, right? We have MDs, DOs that have pretty good training. And it's about that, right? It's about utilizing your credentials and your brain that you've worked really, really hard to gain that understanding on and applying that to these folks. Under this insurance system, it's really hard to do that. It's really hard.
Yeah. You know, you said before going on that doctors on average spend between 2 and 15 minutes, 2 and 12 minutes, and you spend 60.
Yeah.
You know, and I know with our clientele, like just to consider working with them, we do a free 30-minute consult and we still don't have the full story, right? Like it takes so much time. Like I spoke with someone yesterday and I said, okay, tell me, how did your daughter's birthing go? Like, was it a vaginal delivery, C-section, like all of these things? Like what is the entire history, right? And in our healthcare system now, we just can't do that anymore. We're just barely scratching the surface. And so for you to come out with something like Voyage and spend an entire hour with your patients and understand not only their health history and their family's health history, like that's completely revolutionary and unheard of. I'm sure, are there other doctors that are doing stuff like this?
So I'm part of a national movement it's called Direct Primary Care, the national movement. And there are many of us nationally, family docs who recognize the systemic problems and are stepping outside of that system and delivering this kind of care. And it's Direct Primary Care. We have a DPC Alliance.
Okay, so that's like an official organization.
It's awesome. That's awesome. And we're patient advocates. We are going after. We're fiscally and healthcare wise. Our number one why is care, right? We just want to provide better care.
Yes.
And if we can do so in a fiscally responsible way, sweet, and we're crushing it. Yeah.
Absolutely.
Cool.
How many of you are there?
So every month, many, many more. Actually, it's impressive. Yeah, the growth is phenomenal. It's exponential at this point.
That's fantastic.
Yeah, it's great.
At the end, remind me, I'm going to ask you about how people can find out. We have a lot of listeners who are not local, so they couldn't necessarily benefit from your services, but they would definitely love something similar. So
I can tell you that right now. If you
actually,
want.
let's do it.
Yeah. So it's DPC, Direct Primary Care, dpcfrontier.com/mapper. and you'll find a DPC type of a doc in your community.
People like you.
Yep.
That's fantastic. Yep. Will you ever be able to work with people outside of the state, or are you pretty restricted?
Licensure. So you have to have a state licensing
right.
wherever you're practicing medicine. Yeah.
Okay. Very cool.
So I wanted to ask a question, and we talked about this before we started recording, and I think by now it might be kind of obvious to people already, but who specifically can benefit from a direct primary care practice like yours, like Voyage?
So let me just break down the model. So it's typically a membership model, and the fee schedule varies from usually like $69 to $100 a month per adult. Mine's $69 to $89 per adult. And per child, it's usually $10 to $30 a month, and mine's $10 a month.
Wow.
I mean, Utah County got a lot of big families.
Yeah.
I'm trying not to exclude anybody, and so that's why my children's price point is ridiculously low. But my goal is to take care of the whole family, right, as a unit.
Yeah.
And so I know Dad's not going to come in every week, but Mom's going to bring a kid in a lot, and so the goal is to be cost effective for the whole unit, and so that's how I figured out those price points. And the goal is just with membership now to gain unprecedented access to your family doc. Right. And who knows you, who spent time with you, an hour on the first visit, 30 minutes for follow-up visits, and has that relationship, high touch, high quality care. And so, that's the model.
That's really cool.
Right,
so for a family of 4, less than $200, like a mom and dad, 2 children, less than $200, and they're getting, they can come to you as many times as they need. You even do like adjustments and stuff, right?
Yeah, as an osteopath, you do like musculoskeletal adjustments all the time.
That's amazing. And then they can text
you.
Like,
do you do Skype calls with them?
Yeah, video chat, all
need to
all
see
those
this.
Amazing.
Yeah, I can see
Yeah.
Juanique doing that. Like, oh, look at what's on Tennyson's butt.
I don't do that.
Oh, really?
It's been a while. It's been a few years. It's been a while. No, that's like, it's so unheard of. And yet it makes so much sense. Like, why are we not doing this? And
well, we are, right? More and more every month.
Right,
so.
right. But I think the issue is people don't know that this is a service. Like, so with people that already have insurances, how do you fit into their care? How can you benefit them? Because there's a lot of people listening. They're like, I already have insurance. I don't want to spend an extra $150 a month for my family to get higher quality care. And it's so much higher quality too. So how does that fit?
It's a mind shift a little bit because you have unknowingly or knowingly been conditioned by insurance companies in a certain way and to do certain things. And right now, insurance companies have conditioned people away from care. We're pretty healthy. We just don't go to the doctor. But that's what you're saying. But what's in reality is high deductibles, co-pays have pushed you away from care. Yeah. And so it's a little bit of a brain shift. And if folks can recognize the product that their insurance card is delivering and that's there's something better and just buy into that just a little bit. And I'll tell you, 90% of my clients have insurance. They love it. And it's nice to have that on the back burner just in case there's a major catastrophe or surgery or something that I can't do. Yeah. But they love the care that they get from me. And they are like, wow, this is totally worth it. And it's super awesome.
That's fantastic.
So I call it an enhancement to your benefit. So like, you have quote unquote benefits from your employer. It's a, $7,000 per person, $14,000 maximum out of pocket per family plan. And that's great. But for an extra, less than $2,000 a year, you can have unprecedented access to your family doc for 80 to 90% of your care. I do fracture care. I do dermatology. I do pediatric care, newborn care, adult care, lots of care.
That's amazing.
I think it's hilarious. You call it an enhancement to their insurance, but really, even though maybe 5% of their healthcare costs go to Voyage direct primary care,
you're doing all the care.
95%
all
of the
it.
benefit is from that. That's just
you're doing the
insane
job
to me.
they were supposed to do, basically.
And nationally, I think you're going to see this movement because it's a very grassrootsy movement. These family docs are just like, the system is terrible for our patients. We're going to do something different. And I think you're going to see this grassroots movement move forward and people invest in their own healthcare with these family docs. But then you're going to see the third party payers. You're going to see Blue Cross Blue Shield look at it and say, oh yeah, we feel bad. We're charging 20 times more than you charge, and we're only covering 5% of really what their day-to-day stuff are. Yeah. And so I think you're going to see you're going to see the Direct Primary Care Alliance be able to eventually negotiate on bigger terms because we'll take care of all of America, right? And so that's the goal. I think it should be the gold standard of care, of healthcare in America.
Absolutely.
And then because of our transparency and because of the transparent billing and collecting and all that stuff that we can bring to the table, I think you're going to see insurance come down on their price point too, because that's the only way. You can't out-lobby them. They're already way too powerful on the hill.
Yeah.
One quick thing. I'm sorry, I gotta put this in there. A couple of my colleagues with the Direct Primary Care Alliance have went out. In fact, it's another organization called Doctors for Patient Care. Just recently had a meeting with President Trump and signed an executive order to allow HCA or health savings accounts, HSAs, to pay for direct primary care.
Oh, that is
my
amazing.
gosh.
Yeah, that's huge. It's a huge.
That's
huge.
fantastic.
Well,
and
congrats
more
to all of us.
transparency and more transparent. That's what the two executive orders that they got signed.
So is that effective immediately or, oh my gosh.
Yeah, it's huge.
So if you have an HSA, you need to contact Dr. John Sanders right now.
There
and
is
sign up
no
with him.
better use.
I know, right? Like
Absolutely
no better use. That is so
love that.
incredible. Wow. Okay. So
Let's see. I wanted to ask you about actually, I can't remember that question. So all right. You talk about the healthcare companies kind of bringing their price points down to match the market, so to speak. Do you really see the shift in the market in the future being that gentle?
Maybe. What you see now is some innovators. There's some innovators on the insurance realm. And so some of those are your health shares, maybe the Christian Health Ministries, the Liberty Health Shares, the Zion's Health Shares, Stratus Health. There's a bunch of them out there. Sedera just came on the scene last year, and they're kind of innovating that space as well. So the catastrophic space, and their price point is 25-30% of an insurance plan. But folks, the argument against them is that they're kind of being selective on their patient panels, and they are. I'm not. No direct primary care doctors are. We're take whoever comes in and sees you and deliver as much care as they need.
Yeah.
And that's really, honestly, that's the way we should operate. But insurance, I get it. They're number crunchers, and they're going to kind of always look at those things. Yeah. But there are some innovators out there that are delivering some neat, more cost-effective products than the Blue Crosses and the Select Healths and the Aetnas and Cignas and those guys out there.
Cool. So how could the average person take advantage of these shifts in the market to maybe combine some of these innovative insurance companies with the direct primary care movement and sort of maximize their dollar, so to speak?
Yeah, I think talk to your direct primary care docs locally, and because we all keep our finger on that pulse as well, because we provide upwards of 80 to 90% of the healthcare that folks need, but we recognize the need for a catastrophic plan as well, and so we'll keep our eyes on the innovators in that industry, and as they come down and as those things kind of move along. A colleague of mine was a broker. He talked to Blue Cross Blue Shield. This is all word of mouth stuff. And he was talking to them about, hey, direct primary care is this cool movement, and this is what they're doing. And he talked to some of their C-suite folks, and they were like, and he said, well, what can you do for a direct primary care family who is on a plan with you guys? And he said, well, let me go crunch some numbers, and I'll get back with you. And he came back and he said, gosh, if they have direct primary care doc, we're happy to discount their monthly amount by like $300 a month. Like,
wow.
And so more than the price of my, so it's a net win.
Yeah,
absolutely.
So I think as this movement gains more and more traction, you're going to see the payers, hopefully, they're all for profit. So who knows? All bets are off. But there's no question that we will save them millions and millions of dollars. There's no question.
Yeah.
And so especially for like the shops that are self-insured, like the 400 to plus type employee shops, those medium-sized to big-sized businesses, they're already crushing it with on-site docs or near-site docs and those kinds of things. And that's how you can think of me too, is like I'm like an on-site doc for the public, right? For everybody. And so, if we can come up with like a collective self-funded plan, which there's a couple of folks working on actually, even locally in the Utah area, happy to talk about that some other time.
Cool.
So really, it sounds like if a person is motivated and they actually start asking questions, especially if they get connected with a direct primary care doc first, they can potentially save themselves incredible amounts of money.
Yeah, especially if they're self-employed and they don't qualify for the tax break for the ACA plans. Yeah, super home run.
So then who is not a good fit for something like Voyage?
Yeah. So I would argue that everybody's a good fit. Right now with direct primary care, there are direct primary care clinics taking care of all age groups. Right now with Voyage Direct Primary Care, I started up about a year ago, and so occasionally I'll go and moonlight or just work a shift in a rural hospital or a local urgent care or something like that, just because startup funds and things. And so in order to do that, I have to still be qualified for Medicare. I've opted out of all my other payers, so I've dissolved all my contracts with all other payers, but I can't dissolve with Medicare yet. And it's funny, in order to engage with a person differently than insurance, you have to dissolve your contract with them.
Wow.
And so I'd have to basically dissolve my contracts with Medicare, which is a arduous process. And I'm not quite ready to do that. So probably 8 months out, I can take care of Medicare folks. Right now, Voyage Direct Primary Care can't do it. But there are DPC docs nationally doing it all the time.
Very cool.
And in the not too distant future, you'll also be able to do
those are some of my favorite people. Yeah.
That's awesome.
Yeah, fantastic.
Yes.
So are there any downsides to the direct primary care model?
There's some folks that speak against it. I would say their arguments are that we're being selective, which is not true. Their arguments are that we can't, because we do limit our patient panel, because we're trying to deliver 60-minute visits, 30-minute follow-ups, that kind of care. We can't take care of 6,000 patients like the current family docs do now. 3,000 to 6,000 is the current typical panel of family docs,
number.
And that's why they're cranking so fast, right? And it's part of it. And they're scheduled out, 3 and 4 weeks. Yeah. And so we're taking care of smaller patient panels. The argument is that we can't care for all of America in that way. And I would say my rebuttal is continue your current crash course.
Yeah.
And you're burning out all your family docs. You're burning them all out, 6,000 and super inefficient processes and tons of regulation, and you're handcuffing us in so many ways. Yeah. Nobody wants to go into family medicine. Right now, I talk to my colleagues and they're like, actually, direct primary care makes me think I could do family medicine now. And it's totally true. It's beautiful care. It's the way it should be. It's awesome documentation. I'm not spending hours on the computer documenting silliness for insurance purposes. And so I think it could rekindle folks to go into family medicine if this movement continues forward. But yeah, some of the naysayers are speaking in those terms. We're already at a shortage. Now you want to take our shortage and make it shorter. And
we're at a shortage because it's so broken and nobody wants to get into this mess with the insurance companies, right? Yeah. Would you say that if more doctors knew that this was actually an option, do you think they would pursue it? Do you think doctors don't know that this is a thing, actually?
They do, but they're scared. Right?
Oh.
It was so scary for me to just, I have 4 kids, I have a wife in law school, I'm going to jump off this cliff and hope the parachute deploys. Yeah. And it did, and it was beautiful, and it's been awesome. But that was a risk, right? Yeah. And so not all doctors are, they're pretty risk-averse creatures, doctors. And so they're scared. And so I'll lead block away. I'll just, I'll be their fullback and hopefully they'll follow suit. The beautiful thing about this is I'm not in it to compete against anybody. I just want to take care of people in a good way.
Yes.
And then if docs want to come join me, awesome. If they want to do it themselves, I will support them and help them, in fact. And so I'm super happy to collaborate and corroborate with folks. And in fact, you'll see the DPC Alliance nationally, these docs, we're all like-minded. We're all like, hey, how can I help you? And we're all like collaborating on the, Slack channels and Facebook groups. And it's fantastic. It's a really great group of people.
It kind of makes me think of how it might have been in like the 1920s if they actually had the internet back then, right? All these family doctors who were doing home visits, if they could actually communicate with each other, they would probably be having similar conversations.
It's funny. I've had many of my clients say, this is like old school medicine, like back when. I have a sweet doctor bag that I got in medical school.
That's amazing.
I'll go do my house calls with, and it's fun. It's beautiful care. And you can go do a house call on occasion. I'm not transactionally driven by insurance companies.
Yes.
I'm a membership model. Probably 40% of my care is delivered remotely, right? A mom is busy. They've got 5 kids. They text me real quick about their kid with a rash or something. And we can send a picture or do a video chat and take care of a lot of their needs remotely.
Amazing.
That to me is one of the biggest advantages of it, because we don't want to actually drag our kids in.
Oh my gosh, that's so tedious.
Or
thinking
even,
of having to put clothes on my children, get them fed, get them buckled in the car. They're now screaming for 30 minutes as I'm going to the doctor's office because they're fighting over a toy. And then we have to sit silently in a doctor's office and wait for an hour for him to see us for 15 minutes and then redo it all just backwards.
Yeah.
If I can text you or call you and like, oh my gosh. Wow.
Yeah. I mean,
yes.
when we first got decent insurance and it came with a nurse hotline, we were so excited because we thought, it's going to save us so much time.
The nurse hotline was so useless.
We called it the first time and the nurse says, oh, you should probably just take them in. Like, but do you have any advice for us? I mean, no, just take them in. Like, well,
they always default to that. Like one of my friends who was a nurse that actually worked for the military, she was like, no, they have to tell you to go to to go to the ER or something. Like they can't do anything else. Yeah. And so I'm like, this isn't very helpful. Like you're basically just telling me to go see a doctor.
This is what we thought we were going to be getting.
Right?
When
Yes.
we got the nurse hotline. So,
So it's interesting. Small breakoffs of you could see like the businessman trying to like that's a businessman line of thinking. Like, let's provide a hotline for a nurse to do this thing, right? Instead of like, let's provide a direct primary care doc to answer his phone after hours and take care of his small body of patients in a meaningful way.
Yeah.
Same thing with like the telemed thing, right? That's a total like I mean, it's a level of care, but it's not your doctor on the line who knows you and your family taking care of those phone calls.
Yes.
I talked to one guy on Silicon Slopes and he's like, oh yeah, we're totally going to automate family medicine. And I said, the automatable part is our own fault. It's a 5-minute visit where I ask you 3 or 4 questions. I give you a diagnosis and I give you a prescription and I send you out the door. That's automatable. Yeah, you bet you can train a robot to do that.
Yeah.
But that's why we need to step off of that system and create something that's high touch, high quality, relationship driven care that is not automatable, that is actually great care. And yeah, the businessman has no business touching.
I think where that leads is to a scenario where people Google their symptoms like they do now, and then they can actually write their own prescription, which just sounds like a total disaster.
That's exactly
because,
right.
I mean, that's the ultimate automation, right? We just let people
Thank
be
you
their
guys.
own doctor.
I'm so grateful for you guys and our relationship and also your invitation to speak to you today. This has been really fun. I appreciate you.
We are so grateful for your time and the service that you're providing our community that we've always needed and didn't know that we did, right? Yeah. We just thought that we were stuck in the system and the system would always be there. And I feel like that's exactly what it is. We're stuck. And you're now giving an opportunity to people to not be stuck anymore, to actually get the care that they deserve and to have people advocate for them. And that's priceless.
Can I speak to just a couple, one more thing?
Yes.
There's a couple of other folks in our Utah County community doing some membership-driven care. They are 80 to 90% still insurance-driven, and so they're still on that broken bicycle, and they're still pedaling really, really fast. And I'm not. I would argue that their care is different than my care. And so, you know, they're out there. They're good folks. I really kind of like them. But they're just scared to completely jump off of that bicycle that's broken. And understandably so. I get it. I totally get it. I was scared to do it as well. But I believe in the purity of direct primary care, the purity of not being constrained in any way by anybody or any insurance company or any regulation in my relationship with my patients and my ability to take care of them and order whatever they need to be ordered and, you know, take care of them.
So all the folks out there listening to this, if you've come into contact with a membership model before and it didn't work very well for you, look again, because direct primary care is a completely new beast. It's going to fill in all the gaps that were left with the old models for sure.
And potentially completely transform the medical care system that is so broken. Dr. Sanders, thank you so much. Before we end this, is there anything else you want to share with listeners? Anything that you feel is vital for them to know?
Especially how to contact you.
Yes, exactly.
Yes.
Exactly.
Voyage Direct Primary Care, voyagedpc.com is my URL. And
How can they learn more from you too? Like, don't you have a YouTube channel? Tell them all that, that information.
Yeah.
We want to learn more from you. We want more Dr. Sanders.
Yeah, we'll throw these up on the show notes too. So no need for people to memorize it.
Sure. Voyage DPC. I have an Instagram account. I have a Facebook account as well. I also have a YouTube channel where I'm trying to educate, 2 to 3 minute videos on the difference between the common cold and strep, right? Because I saw that kid and I was like, I don't want nobody to ever to have that issue again.
Yes.
And so I did a quick video on it and showed them just here, as the mother of a child who comes in with a sore throat, like, how do I know if it's a cold or if it's strep? And so just little things like that. I've got a YouTube channel up there as well.
There's a really cool one out there he did on vertigo.
Oh, yeah.
I believe it was the Epley maneuver. Is that what it is?
Epley's a big complex. Yeah.
Check that one out. It's fun.
Thank you so much for your time.
Thank you.